to demonstrate how to stretch a piriformis muscle. The piriformis is the small muscle that's deep in the buttock area. It runs from the hip bone and runs over and attaches to the sacrum. All of the other larger muscles back here attach to part of the pelvis. The piriformis muscle gets tight because it usually was trying to take over the work of the larger muscles that are inactive and not working. So that muscle is lined up so it can take over that extra work. It also attaches to the sacrum, so if the sacrum doesn't move well, that muscle's pulling against something it can't move. So usually, and then the sciatic nerve runs just under that muscle as well. So we find it's very beneficial for our patients to be able to stretch that muscle to loosen it up. All right, supine piriformis stretch. You do it lying on your back in supine. I'm going to have Will imagine that we have a box placed on his stomach with the wall of the box right about here. He's going to begin by bringing his leg up to the wall of the box. So now the thigh is vertical. He's going to bring it over to the center of his body. So it's lined up right in the middle, keeping it there. He's going to cross the leg over to here. He'll grab his ankle and grab his knee. Now he's come a little bit into the box, so we're going to back out just a little bit, keeping the hands on it. Now when Will stretches the muscle, he's going to pull so that 70% of his pull, of his effort, is pulling his ankle toward the shoulder. The other 30% is going to be pulling the knee to the chest. So when he begins to pull into the box, most of his pulls this outside hand. And with that, he should feel a nice stretch deep in the buttock area. Some people feel a stretch that might travel a little bit farther down the leg. Any stretch in the back of the hip area is fine. So he's going to hold that at least 20 seconds. These things can be held longer if you so desire. So after holding it at least 20 seconds, then he's going to stretch the other side. So again, he brings the leg up to the wall of the box, cross it over, grab the ankle. Now again, if he comes into it, he backs out, bring the knee over to the center so it's right in the middle of the body, and then 70-30 pull. Very good. Now what you see a lot of people do is they begin to pull and this leg drifts out and comes up this way, which it goes a lot farther. So we're not interested in doing that. We're interested in getting this nice deep stretch in the buttock. If you have a knee that's a little bit uncomfortable, you can take this hand and grab up closer to the knee. If your knee is really uncomfortable, you could grab underneath the knee and try to keep that twist as you pull. So there are different hand grab options that you can use. I've had some people with very restricted knee range of motion, so the knee has to remain more or less here at a 90-degree angle. So again, they can get a piriformis stretch just by pulling under the knee. So all these stretches would be held, like I say, a minimum of 20 seconds. Usually you can do 2 or 3 on each side. There are other options on working on the piriformis. We'll go over a quadruped stretch, meaning you start out on all fours. Some people in yoga call this pigeon pose. There's also piriformis massage techniques that we'll go over. So if the muscle's really knotted up and not really loosening as quickly as we want, we've got a couple other options. But this also should be done in conjunction with loosening the sacrum and doing gluteal retraining so that you take the load off of that small muscle so it can be allowed to loosen up.